Hi, everyone. Good evening. Carl Steinbeck here. Want to cover some more of the Lindsay Clancy trial that went on this past week. I've not covered it since last Sunday, so I was hoping to jump on a lot sooner than that. But, a lot of this stuff was just rehashing the minute details of the medical professionals. And we did see some this past week, some of the insights into what they were doing to really try to help her, but were they really trying to help her, or were they just creating more of a problem for her psychosis? And did she have psychosis? So, going to take a snapshot of some of the things going on this past week and give you some of my insights, what I think is going on. I think a recurring theme throughout this trial is these two prosecutors are excessively leading in their questions. They pretty much are doing most of the testifying, and hardly any of the witnesses that are being called really get to just say answer open-ended question like what happened next, what happened next, what happened next, and they just go through and walk the jury through what they did. Instead, what's happening is the prosecutor is tightly controlling it, leading as all get out, and so the witnesses sort of just getting up on the witness stand. They're saying, yes, that's correct. Yes, that's correct. Yes, 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 that's correct. Instead of explaining, you got to try to humanize your witnesses as a prosecutor. And I don't see them doing that really. Are they trying to get through this? It seems like they're trying to rush through it. And so, as a defense attorney, from their perspective, you could be objecting and making them lay out the foundation with all these witness questions and make them ask open-ended questions. And they're not doing that. But I think one of the things that I would do as a prosecutor, excuse me, if I was a defense attorney in these cases, I would probably not be objecting either, like this Reddington's doing, because what happens is when you have prosecutors that are doing all this talking in the courtroom and hardly anything's coming out of the witness's mouth, day after day after day, this sort of like they get punch drunk. They get tired of listening to these prosecutors, and they don't seem to really have a lot of read on how the jury would interpret this. So they're just going on the same motif all throughout the day, and then you have all these breaks on top of it. So I think the jury is like really wanting to get this case moved on, and because the defense is totally um, conceding that that Lindsay's the party that was responsible because these children of hers died at her hands, then what's happening is they're sort of like, okay, well, let's get to the mental stuff and medical stuff. If this is what the defense is, so that's one thing the prosecutors are doing, but it seems like they're just way too much in the lead mode instead of the open-ended question mode. And so defense, by them then asking open questions on their cross, it's almost like it's reversed roles. A prosecutor is playing the defense role of leading, and then the defense is asking open-ended questions. So anyway, let's go ahead here. I'm going to show this here. Let's go to on the first. This started out with the cross-examination of Dr. Jennifer Tufts, and she was one of the main providers for Lindsay. And she's one of the ones that's being sued as well by both Patrick Clancy, her ex-husband, as well as Lindsay. So let's see here how this starts. So they had all weekend last year on this past Monday. Nervous. This witness is
Good morning, Doc.
dreading this all weekend, having to come
All right.
testify.
Ms. Reddington?
She's only got a few years' experience.
Good morning, Doctor.
Good morning.
Do you have your record in front of you, your notes?
I do.
And you can look at that.
Reddington's doing a really good job. He's been very likable.
Thank you.
I can't say about the prosecution.
Dr. Tufts, you are presently a psychiatrist, correct?
Correct.
And can you tell me where you went to med school?
University of Vermont,
And what were the years that you were at University of Vermont?
2014 to 2018.
Beautiful country. Great place to live, right?
It is. It's beautiful.
And when you graduated from med school, you then did your residency?
Correct.
And where was the residency?
Boston Medical Center.
And can you tell me, what is it exactly that you do as a psychiatric resident or a psychiatrist resident? What do you do?
You do a lot of different things. You rotate in all the different aspects of psychiatry, as well as internal medicine, so that you have a foundational knowledge of broad medical topics. You admit patients into the inpatient hospital. You manage emergencies in the hospital and in the emergency room, decide whether patients need to be admitted psychiatrically or not, and also carry a panel of outpatients.
And is this a hospital that you're working in, or is it Boston University? Is it a medical center?
So yes, it's the Boston University program, located at the hospital, Boston Medical Center, with also a lot of time spent at the various Boston VA locations.
And what were the years, I'm sorry, that you did your residency?
2018 to 2022.
So you basically were working as either a person studying to be a doctor, graduating, and then becoming a resident for the entire pandemic.
For the first part of the pandemic, yes.
The pandemic ended when Joe Biden said it ended in July 2022, right?
I'm not sure exactly when he said that.
Would you agree with me that when the pandemic started, around 2019, when you began your residency, 2020, 21,
I would say 2020.
it was a large push, if you will, of the pandemic.
February, March 2020. Ooh, what happened there? All right. We just. What's the link there? Sorry about that. Okay, something's going on here. Why is it showing live view? That's not the link that I have. Okay. Interesting. It's showing something different on.
Different times. I began my program before the pandemic.
All right, let me jump ahead.
You were a delivery nurse with a woman who's having a baby directly in front of you.
I imagine not.
So when you finished, did you graduate from a residency, or is it like you get a certificate or something?
Yes, there is a certificate for completing it.
And then at that point, you are now a licensed doctor. Is that how it works?
Well, you're actually a licensed doctor the entire time that you're in residency. But upon the completion of that, you can obtain a full, unrestricted Massachusetts license and also become board certified.
And the board certification, for example, you have a board certification in general psychiatry, is that right?
Yes, sir.
And when was it that you got that certification?
When was it?
Yes.
It was September 12th, 2022.
Wow.
When was it that you actually started working as a physician, as a psychiatrist?
I started working as a physician and as a psychiatrist during the residency training program. But I started practicing completely independently at Astor Mental Health in August of 2022.
August of 2022.
Yes.
Now, prior to working with or at Astor, is that ASTOR or ER?
ASTER, like the flower.
What is Astor? What is it, like a group of doctors? Is it a medical center? What is it?
It is a outpatient practice that is owned by a psychiatrist. It has a number of psychiatrists as well as therapists.
And where's it located? Is it a brick and mortar type place where you have offices?
Yes, the original offices were in Braintree, Massachusetts, and now there's an office in Peabody as well.
Your office, where you work?
So at the time I saw the patient, I was working in the Braintree office. I currently work in Peabody.
So she basically was a brand new, just licensed, just completed residency psychiatrist when she started seeing Lindsay. So you could not ask for a more complicated, complex situation, I would say, than what Lindsay was going through at this time. And here you have somebody that looks like half the age of Lindsay and looks like she's been, still in high school, basically. But she's obviously accomplished by what she's done at school and whatnot. But how much experience does she have in residency, really knowing the effects of these different medications on somebody going through postpartum depression, extreme depression, and you add psychosis on top of it, and you add these various side effects of these drugs. So,
I'm sorry.
Currently in Peabody, Massachusetts.
So when you start working at Astor, obviously like anybody else, you submit a resume, an application, you perhaps have been hired, right?
It's a fairly lengthy process and a number of interviews with different staff at the practice, and some recommendations, letters of reference, verification of credentials, all of that. But yes, it can be comparable to another profession in that process.
Now, in August of 22, when congratulations, obviously you were hired by Astor, how many women had you treated in your residency that were postpartum?
okay, so maybe Max saying, don't be ageist, Carl, not fair. Okay, well, I think it's just common sense that would you want brain surgery done if you needed brain surgery by somebody that just started out their first month? I don't think so. That's all I'm talking about. You want people with experience. More complex it is, you need more experience, right? It's just common sense. That's how we do things in life. We try to get the best outcome.
With postpartum depression? Or just in the postpartum period?
How many women that were in the postpartum period did you treat prior to August of 22?
Many. It's hard to give an exact number, but I did have specific training in that population.
In that population? And where did you have the training in that population?
At Boston Medical Center.
And can you tell us in that 2-year period approximately how many that were in the postpartum period that you treated as a resident?
Okay, so it's really hard to give an exact number, but if I had to say, at least 50.
So in the 2-year period, you treated 50 people in the residency that had postpartum. And can you tell me what is postpartum? What is that?
Well, I just want to address that it was a 4-year period, not a 2-year period.
Oh, I'm sorry. Okay.
And sorry, what was your question?
Hold on. You saw 50 people in a 4-year period that had postpartum. In other words, they had them after having the baby, right?
Possibly, more or less. I saw a number of other patients. I saw much more than 50, but yes.
That seems like a high number. Let me go back to normal speed here.
So after you had your residency and after you were hired by Astor, is that when you began in August of 22 your practice as a practicing psychiatrist?
Yes.
And when was it that you actually got your DEA license that authorizes you to prescribe medication to citizens?
So during residency, I had a DEA license, but it was affiliated with the with Boston Medical Center. And then when I started at Astor, I had my own DEA number. I don't know exactly when, maybe sometime around August.
So August of 22, you start working at Astor. August of 22, you got your DEA license individually that authorized you to prescribe medication, correct?
Yes.
And it was when that you saw Lindsay Clancy?
I believe our first visit was September 15th
Of
2022.
So you were practicing as a psychiatrist for a little more than a month.
I was practicing independently with my full credentials for about a month. But the training is just immense that goes on before that.
Absolutely, it must be. But that's a residency that you're talking about, right?
Yes.
And you know what a residency, I mean, all I know is Grey's Anatomy, but I mean, you're working under a doctor, the doctors are supervising you and they tell you what to do and then you report to them, correct?
They don't really tell you what to do. They're there as a resource if you need additional support. But I followed many of my own patients. I was the only person in the room with them. And, my notes were signed off by an attending physician, and that attending was available for any support it needed.
So in August of 22, when you started working at Astor, you actually filled out a form for your advertising. Is that correct?
I believe that was handled by other people at the practice.
And who would that be?
Well, we have non-clinical staff that handle the administrative matters.
Okay, but you're a doctor and you're out there to the public. You're advertising yourself and your services to the public. Is that fair?
I believe, yes. I'm not directing the marketing of our office, but yes.
Okay, never mind your office. I'm talking about you. You had an ad that was on the computer that if somebody wanted to reach out to a doctor, they could see your ad amongst many others, right?
Well, I don't think there was an ad. I think we have a website that had some information about myself.
Okay. Now, in August of 22, up until when you saw Lindsay, how many patients in that month or so had you treated for postpartum psychosis?
How many patients in a month up until that month?
I'm asking you about when you started working in August of 22 for Astor, and you are now on your own as an employee. How many patients had you treated before you saw Lindsay Clancy postpartum psychosis?
Well, in the span of 1 month, I would say none because it's a very rare disorder.
Okay. But it exists, doesn't it?
Absolutely.
And one of the things would be the voices that people hear, right?
That is a symptom of psychosis. Absolutely.
And that's legitimate, isn't it?
It is a legitimate diagnosis. Absolutely.
It's not a diagnosis. People that have postpartum psychosis hear voices, do they not?
Many do. The disorder can manifest differently in different people, but yes, many people do hear voices.
How about postpartum depression? How many people in that month or so before you met Lindsay did you treat for postpartum depression?
In the span of 1 month, it's really hard to pinpoint that. Maybe a couple.
Maybe a couple? And do you recall how long you treated them for?
Again, it's hard to really pin down the individuals in a short span.
So he's asking all these open-ended questions. He's letting her just answer however she feels fit to. He's not forcing her into yes, no type answers. And that's pretty much what the prosecution has been doing, is leading all of her own witnesses. These two prosecutors, they're leading their own witnesses. And then the defense is doing the opposite, which is just asking open-ended questions for the most part.
Time.
Can you tell the jury what you put in your ad or in the Astor website that you indicated that described you?
I don't recall.
Well, one of the things you did is that you said that you basically were a specialist in postpartum, people that have postpartum psychiatry. You indicated that on the website, didn't you?
Are you able to read the actual document? I don't remember exactly the wording.
You've been working now for how many years now? 3 since you saw this? Or more?
Almost 4, yes.
You haven't changed your ad on the website, have you?
I have not personally, no.
And you've read it probably a bunch of times, right?
I've read it a couple of times, but I don't spend a lot of time on my website.
Okay. Do you recall that you indicated that you were specializing in any particular aspect?
So
of psychiatry?
yes, it probably includes a special interest in women's health, in perinatal psychiatry, in trauma-related disorders, anxiety, and there may be some other things that were mentioned.
Yeah, like women that have babies and they're suffering from postpartum depression, right?
Absolutely.
You advertise that after a month in working for Asta, right?
That's listed as one of my interests, definitely.
And again, forgive me, how many women did you treat for postpartum depression in that month and a half before you met Lindsay?
I don't know, maybe a couple. But I've treated many of them in the residency, which was just immediately before.
So when a person needs to see a psychiatrist, generally they're not well. Is that fair?
Some are not well. It really can vary.
So when someone comes to see a psychiatrist like you, it's because they need help, right?
Yes.
And when they come to you because they need help, for example, with Lindsay Clancy, she came to you because of your ad, right? Or your website for Asta, what you said about yourself.
I don't know exactly how she found us.
Well, do you know why she came to see you?
I'm not sure exactly.
Friday, we spent a long period.
How can you be not sure why she came to see you? That's a bizarre answer. If you don't know why she came to see you, then why were you issuing her all these prescriptions for psych meds?
Time going through your initial or the initial intake that she had to fill out. Is that correct? You recall that?
Yes, we did.
And the district attorney kept asking you, and this is in September, is it September 12th? Is that when that form was filled out?
I believe she completed the form on the 12th. The appointment was on the 15th.
So what does a person do? Do they call you or do they talk to somebody in administration? How do you get the form to fill out?
Yes, our administration handles that.
And what do they do? How does that happen?
They send them the documents, probably by email, and the patient fills them out. It might be all within the portal that we use.
Within the portal?
The patient portal, yes.
Okay, and that means that you go online and you can access Asta Mental Health, and then all these little drop-down boxes would come up?
Something like that.
Are you aware? Is it something like that, or are you aware of what it does?
So because I don't handle the scheduling and the sending of forms, I don't know exactly what it looks like.
Well, this is the form that you're giving a person that needs help because they're possibly mentally ill. Is that right?
Yes, and what's important is that I review the forms and we go through them in the appointment. Absolutely. Yes.
Now, understand that your records, Exhibit 219, I believe, the jury will have access to the Tufts records. Okay, you're aware of that, right? You know what's an exhibit?
Yes.
Because you have talked to the prosecution about what an exhibit is, and you know that your records are now in evidence before this jury, right?
If that's what you say, yes.
I wouldn't take what I say.
Well, I
If you
don't
know,
really,
that's fine.
I don't know the details of how this works. But
Have you talked to them prior to your testimony?
no,
You haven't talked to the DA's office?
no, not at all.
You're a defendant in a very large lawsuit, are you not?
You notice that? Why she's squeezing her eyes when she says no? It would be very odd for prosecutors not to interview a doctor before they testify.
If that's what you
A doctor that's the defense is pinning a lot of their defense directly at this individual's treatment or lack of it towards Lindsay Clancy. So let's see.
say, yes.
I wouldn't take what I say.
Well, I
If you
don't
know,
really,
that's fine.
I don't know the details of how this works. But
Have you talked to them prior to your testimony?
no,
You haven't talked to the DA's office?
no, not at all.
You're a defendant in a very
I'm just telling you, that's what I've seen for all my years of trying cases. When somebody squeezes their eyes like that, that's a clue you hit a soft spot. There's something there that's consciously triggered. So maybe she's wondering if that's the right answer or not. She talked to somebody in the prosecution's office. Maybe she wasn't sure if it's a prosecutor, but that's something to sometimes I ask, why did you squeeze your eyes twice when I ask you those two questions? And then just start going into it from there.
Large lawsuit, are you not?
Yes,
You wouldn't happen to be represented by an attorney, would you?
I am.
And the fact that you have an attorney is your right under the Constitution. It doesn't mean that you're guilty of anything, right?
Right.
Okay.
A crime, yeah. But you notice this is something that I was saying in so many of these trials. We have witnesses on the stand that are being impeached by cross-examination, and nothing's brought out but the fact that they got a lawyer in the room. So think about it. We had lawyers in the room for the prosecution witnesses and Kieran Reed. We had lawyers in the room for the Adelsons that testified, and ones that weren't charged yet, this called as witnesses, and yet we don't have defense counsel bringing that up, or the prosecution bringing it up as well when it's when they're on the side of the truth. So just a good thing to do here, I think, for the prosecutor to show that she's worried about her testimony. She's worried about being found liable. Everything she's saying has consequences for her future, and what she's saying here and the outcome of this case could determine well what kind of damages she's going to have to pay, as well as her business that she worked for.
And you know that the outcome of this case is very, very major to the outcome of your lawsuit. Is that right? Okay.
I don't.
Prosecution objected. They're trying to protect this, so the judge overruled it. Yeah, of course she's got motive, and she's worried about it. I mean, anybody would be in that situation, but she's directly tied to the treatment, and the treatment it was sufficient or not sufficient. That's the issue that defense is raising in defense of Lindsay Clancy. Either it's not guilty by reason of insanity, they're submitting to the jury, or else it's involuntary intoxication, which is a complete defense. So this is the heart of the case. Was she in psychosis? Did she have the ability to understand right from wrong and how she acted? And so we're gonna see more of this here. Stand by.
Actually know that.
So you understand that if in fact it's determined that you advertised as an expert in postpartum and in postpartum psychiatry, and you had a month experience plus a residence, would you consider that to be negligent or misrepresentation?
I do not believe that I have been negligent.
Do you understand what misrepresentation means?
Yes.
With a month under your belt plus your residency, do you really want this jury to believe that you were an expert and you advertised that?
I don't think that's exactly the wording that I used. I think I said that it was an interest of mine.
You were less.
No, go ahead. Good.
So she's saying no, she never said she was an expert in this, only an interest of hers. Well, she somewhat specializes in it. Why would you put that in there if you have such little experience? And this is such a huge area of complexity that if you do it, you give the wrong meds, you can have them end their life or end multiple lives.
I just think the wording was that it's an interest of mine. I don't believe I called myself an expert.
Are you an expert in postpartum?
I may be. I don't know. I think it's.
I may be. Really? After just 3 years, you become an expert in it. Okay, that's not very self-assured on her experience there, her qualifications. I'm sure they're going to use that against her in the civil case.
Depends on what you define an expert as.
Well, when a patient comes to you and they fill out the form, you agree with me that your records reflect that form that she filled out on September 12th of 2022, right?
Yes.
And the form that the district attorney went through painstakingly with you is basically, it looks something like this, right? That's one of the forms that you got people fill out, right? Right?
Yes.
You see the little check mark?
Yes.
Who puts the check mark in there?
The patient.
So how many pages, because I don't want to go through all the pages again. How many pages does a patient, or how many pages did Lindsay go through to check the boxes for aspirin?
There were a lot of pages.
What's a lot, 10, 20?
Yeah, maybe between 10 and 20.
And basically, they're all little checks in boxes, correct?
Not just checks.
No? So does the person then answer questions by typing in an answer such as, do you have any pending legal problems? No. Have you ever been arrested? No. Things of that nature, right?
Those are some of the questions.
And the questions also, do they ask the patient what medications they were on
Yes.
before seeing you?
Yes.
And Lindsay told you that she was on SSRIs in the past, right?
Yes.
And SSRI means what?
A selective serotonin reuptake inhibitor.
And that's pretty powerful stuff.
It's an effective treatment for depression and anxiety.
Well, it affects the serotonin levels in the brain, doesn't it?
Yes.
It rewires the brain, doesn't it?
It doesn't rewire the brain. It increases the serotonin, and many individuals with depression have low levels of serotonin.
So Lindsay told you that she had been prescribed an SSRI when she was in nursing school. Is that right?
Yes.
What was the SSRI?
Prozac.
And how long was she on the Prozac?
I'm not sure.
Never asked.
I probably asked.
Probably asked. Isn't it true? Don't you guys have a saying that if it's not written, it didn't happen? You take copious notes, do you not?
It's impossible to write down every single thing that's said. So I write down what is clinically relevant, clinically necessary. But there's a lot that is discussed over an hour that is not able to be written down.
There's a lot. Yeah, there's a lot. I would say probably most of these psychiatrists like her do not really write a whole lot down at all. They're not like, have an hour and a half. You probably have maybe couple small paragraphs at all is all you have. So I think the lack of detail is going to come back in the civil suit and create problems for her, because a lot of things she's going to have to, I don't know, didn't she tell you this? I don't know, I don't remember, because you don't have it in your notes. So she may have not thought it's important then, but it became important. Everything she said and what they talked about is obviously important because of what the outcome became.
Such as the fact that a person was on an SSRI when they were in nursing school is not an important fact to find out.
Oh, no, that's important. Sorry.
No problem. I'm not doing, the Sophie Cunningham act. I'm just asking a question. That's all, and you can answer it, okay? How about if she had a reaction to Prozac?
I asked her about the Prozac.
Is that written in your notes?
Yes.
And what did she say?
She said that she took it for a period of time. She didn't mention any side effects.
Oh, she didn't tell you that she had side effects. I see. So when a patient comes to see you with a month under your belt and they're sick and they're looking for help, you wait for them to volunteer facts to you?
She volunteered a lot of information. She knew very well what her medical history was and was able to provide that for me.
Such as what? That she was in nursing school and took Prozac?
That's part of it.
And she told you that, right?
Yes.
And she was pretty upfront and honest with you, wasn't she, in answering these questions, right?
I believe that she was.
We all spent some time talking about the fact that she declared that she had consumed alcohol, that she felt guilty about it. Recall that on Friday? We dwelled on that for a while, didn't we?
Yeah, yes, that was a component. Yes.
I mean, that's something that's important, right?
Music, you're asking, would Kevin likely be working with Rosemary, which is the civil lawyer, to include questions in his cross-exam that could be helpful to Lindsay in her civil case? I can see that happening totally. Some of these questions seem like they're really going to the heart of the matter here, but also they're at the civil case. And I'm not sure exactly where they're at in that process. Zelda's asking, I wonder if you think Lindsay was suicidal and decided to take her kids with her instead of psychosis. Does that change of punitive measures? I don't think you can really slice and dice it that way. I think you have to, and the jury doesn't have to have unanimity in all of this. One of them could think it's one thing of something that meets the defense for lack of for insanity, and the other one could be, I don't think there's an issue of there is an issue of psychosis. So this mental health stuff, I don't think there's a cookie cutter way that everyone has to agree to. And I do have to agree on the actual whether it's not guilty by reason of insanity or whether it is the not guilty because of the involuntary intoxication. So how they all get there to either one of those two things, me personally, if she's suicidal, I think it has to do with the depression and a combination of the drugs as well. And the psychosis thing, can you actually pin it on psychosis versus the side effects of the drugs making you homicidal and suicidal? I don't think you really know. So I think the prosecution has to be able to explain all that away as it's not a reasonable doubt that those things could have been affecting her. So it's a high burden for the prosecution. And it's this mental health stuff. It's like a greased pig. It's hard to get your arms around it, and a lot of people have strong opinions on it. So that's why this thing could be looking like a hung jury.
Yes.
What was her drink of choice?
I'm not sure.
Did you ever ask her?
I'm not sure.
She looked over all of her medication prescriptions. She's looked over all of her notes before she testified. I assume she did, and yet she doesn't know basic, simple questions.
We're not concerned that her level of alcohol use
Well, he certainly was Friday, right?
All right, well, here's, and everybody knows, doctor, wait for the question, all right? And then same thing, I'll have counsel wait until you finish your answer, all right? Go ahead, Ms. Remington.
So is it important, doctor, for you as a physician to know your patient? In other words, know who they have?
Yes.
And you know that Lindsay was a nurse.
You know, that's an interesting question. And I think that's also geared toward the civil side of it. Do you really get to know your patient when you're just in there 20 minutes and you're just trying to think of what drug are you going to write a prescription for?
Level of alcohol use
Well, he certainly was Friday, right?
All right, well, here's, and everybody knows, doctor, wait for the question, all right? And then same thing, I'll have counsel wait until you finish your answer, all right? Go ahead, Ms. Remington.
So is it important, doctor, for you as a physician to know your patient? In other words, know who they have?
Yes.
And you know that Lindsay was a nurse, correct?
Yes.
You know that she graduated obviously from college, right?
Yes.
Is she a good student?
Just general, but basic information. They don't really get a chance to get to know them. They're just asking them, how are these meds affecting them each time? That's pretty much what they're going to be following up with.
I don't recall.
Do you know when she got married?
I don't recall
Did you
a
ask her?
specific detail. I don't know. I knew she was married.
She had 3 kids, right?
Yes.
And the reason that you know that she was married is because you spoke to her husband, Patrick, correct? Or did you?
Sorry?
Or did you?
He attended one of the appointments, and I spoke with him on that date.
And did you say hi, how are you? Did you give him a handshake when you came in your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine. Is it fair to say that after, 14, you said to the jury, 14 appointments that you had with Lindsay during that period from September till January? 14 appointments?
Yes.
Every single one of them were by telemedicine, weren't they?
Yes.
Until you came in this courtroom Friday, you never saw this woman in person, did you?
Correct.
Were you ever?
Shocker. That's a shocker. Never seen her face to face. Granted, it was during
Concerned about her?
COVID, so that was a norm for a lot of places, but it's just, it really does impede, I think, if they're doing an interview through a Zoom, they're having that instead of a face to face, doing it through Zoom. They're just not going to, it's not the same. You can't read the person the same way.
Mental health as a person?
Absolutely.
She was crying. She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time, she said it was difficult to get out of bed
Oh, difficult to get out. Why was it difficult for Lindsay Clancy to get out of bed?
because she was very depressed.
And did you give her a hug? Oh, no, you're on telemedicine, so you couldn't give her a hug, could you? You didn't have any chance to even look at her in person, did you?
I could look at her. It was always a video appointment. I couldn't give her a hug, but that's not actually something that psychiatrists typically do with patients.
I imagine. Now, I'm looking at you, and you've got the witness stand cutting you off in half, right? So I can't see from your waist down, your legs, your feet, your hands, anything. That's the same view that you have on the telemedicine, right?
Yes.
Isn't it fair to say that you've studied and that you've learned that there are objective manifestations that patients may have that would be a tell, like if you're playing poker, you have a tell, that would be an indicia of the fact that they're stressed or emotionally disturbed, right?
Yes.
Like hand wringing, right?
Yes.
Were you able to see the hands wringing when you were on telemedicine?
I don't recall seeing her hands.
Recall, you know how people sit there and they do this with their leg and the leg bounces because they're going through some type of emotional stress? You couldn't even see her legs, could you?
I couldn't see her legs, but I knew that she was under stress.
So when she came to you, September 15th, I believe, is the first time that you all actually discussed her condition, correct?
Yes.
And looking at the medical records, which the jury will be able to look at, it says visit date September 15th, 2022, and you can look along with me if you wish. Indicates why she came to see you, right?
Yes.
Right? Yes?
Yes.
Okay. Why did she come to see you? According, not guessing and speculating, never mind the TV. You just look at your notes. Tell me what brought Lindsay Clancy to your office.
Postpartum anxiety.
Is that it? Is that what you noted in the records?
Well, those were her words when asked, what are the problems for which you are seeking help?
I see. Postpartum anxiety. Now, as a psychiatrist, meeting with this young woman after a month or so of working as a psychiatrist for ASPR, there are tests that you administer to a woman who's in postpartum to find out what type of anxiety they have, right?
Well, there are some screening tests, but the most important thing is what the patient tells you and what my assessment is in the session.
I see. And that would carry through the Tufts evaluations for all 14 of those meetings, is what the patient tells you, right?
Yes, and what I observe in the session
Through the television.
through the computer.
What, if you can tell me, is the Edinburgh test?
It is a scale that looks at symptoms of postpartum depression.
And when you administer, that's a major test, isn't it, for a doctor to evaluate a patient for PPD?
I wouldn't say it's a major test.
It's a pretty big one, though, isn't it? It's the only one that measures the postpartum depression, right?
It's a common one.
So what?
Commonly used.
All right, so when you used it on Lindsay, when was that administered to her?
I did not use it on Lindsay.
Why?
We used the PHQ-9, which
What
is
PHQ-9?
it's a depression screening form.
That's like generalized anxiety disorder, general depression. It's got nothing to do with a woman suffering from postpartum depression, does it?
I disagree.
Well, do you agree that people perhaps that may know a little more than you determined that the Edinburgh scale is the appropriate scale to administer to a pregnant or postpartum woman?
Sustained as the form.
You're familiar with the Edinburgh scale, right?
I've heard of it.
And can you explain to me how it's graded?
No, I cannot.
In other words, that's probably why she's not using this test, because she doesn't know how to grade it, how it works.
There are 30 questions in it, are there not?
I don't use this scale, so I don't know how many questions there are.
So the Edinburgh scale, do you even know that the cutoff for someone that is depressed in their condition of postpartum would be 15? Anything over that, they're in severe depression?
Okay.
You know that her
Okay.
first
She knows nothing about this test. This is bizarre.
Edinburgh test that was administered to her put her at a 23 overall. Severe depression.
I was
Prosecution should not be objecting to this. This is relevant cross-examination, so this needs to be fleshed out.
not aware of this test. I was not aware that this had been administered to her.
Well, you know that except for the Prozac that she had when she was a nurse, what, 23 years old, she hadn't, other than seeing her own doctor for having the baby, she hadn't seen any doctors. You knew that, right?
I didn't know exactly which doctor she sees. I think we ask about your primary care doctor, but she did not report any other medical issues that she was under treatment for.
So is it important for Dr. Jennifer Tufts to know whether or not a patient who is coming to you for help has a prior medical history other than what they might tell you?
Well, when patients are able to advocate for themselves and share their medical history, we rely on what they tell us.
Was she able to advocate for herself, in your opinion, when she came to see you, when you evaluated her in September?
Absolutely.
How about October?
Yes.
How about November?
Yes.
How about December?
Yes.
And your medical records, you would agree, show that during that period of time that she was deteriorating, was a word that was used on Friday. Isn't that right?
So
No. You used the word deteriorating on Friday, did you not?
she was a little bit worse at certain appointments, and the deteriorating word, which is not my word choice, is what is in the note because I had to select that.
Because why? You have some kind of a program that you have to check the box and you have to bring down the drop box. You can't take a pen and write something down about a patient.
There are certain parts of the note where I can write whatever I feel is necessary, but that specific aspect of the note is a button where you have to click one of three choices.
So when the jury's going through your medical records, one of the things that they're going to see is that when you meet with the patient, you have a form that you fill out where it says, if you feel like you're going to harm yourself or somebody else, make sure you go to the emergency room, right?
Yes.
If you have any urges to harm yourself or others, go to the nearest emergency room. That's That's in every single time that you meet with a patient, right?
Yes.
And it indicates that if there's any, call the suicide prevention and crisis hotline. If you feel that you're in crisis, you may text home to a particular number anytime. What's a suicide hotline?
It's a phone number that patients in crisis can call and speak to a trained counselor
Jump ahead here.
that eventually things it.
You're right,
I mentioned that.
Excuse me.
Hold on.
So yes or no?
Hold on. You gotta let her finish the question. If you listen to the question and answer just what they asked, okay? Go ahead. You can rephrase that question, Counsel.
No, I'll let her answer.
All right.
I mentioned that I provided supportive therapy.
What is supportive therapy?
Yeah, I agree, Susan. And when you have someone giving you medication and they get kickbacks and they can make millions of dollars on kickbacks, there's something wrong with that. There should be mandatory disclosure of that. But there's not.
It's listening to the patient's concerns and providing emotional support and validation.
So emotional support and validation, all sounds good. Here's a young woman who was what, 20, 29, 30 years old, came to see you?
Yes.
And came to see you for help, right?
Yes.
Told you she couldn't sleep and she was anxious, correct?
Yes.
You know that she was postpartum, correct?
Yes.
You know that as a patient who was postpartum. By the way, what is your opinion of the period of postpartum wherein one can have postpartum depression or, more importantly, postpartum psychosis? What's the time frame?
It's typically 1 year.
So she was well within that time frame, correct?
Yes.
And you tried to provide therapy by giving her hope. And how long do you figure did that take? 5 minutes, 10 minutes, 2 minutes?
I'm not sure. I think it was different in each session.
Okay. So the only thing that you diagnosed Lindsay with on September.
That's good that you don't accept kickbacks, recovering book hoarder for the mental health agency you run.
September 5th.
But that's a real rarity, right? Most folks do not pass the opportunity to get all those kickbacks.
It was GAD, generalized anxiety disorder, correct?
It was generalized anxiety disorder as well as an adjustment disorder with depressed mood.
And you prescribed medications to her, right?
Yes.
And the medication that you provided to her was the sertraline, right?
Yes.
The sertraline would be Zoloft, right?
Yes.
Now, this is a little chart that shows the prescriptions that Lindsay was on. And you are the yellow colors. Okay. You can see that. Would you agree with me that on September 15th, you prescribed sertraline, Zoloft, 30 count on September 15th, 25 milligrams, right?
Yes.
There's that chart again with all the meds she was given at different times, and based on the color, I believe it was, on the right column, that determines which provider provided it. By the way, I'm doing an analysis here of this testimony. I'm going to be going on to some other parts of the trial from last week. So I saw there's a couple people that complained that I interrupt and stop the video. So if you want to see a clean, straight through video, this is not it. It's not the channel for that. I'm going to be doing occasional stops and making commentary where I think it's appropriate. So in other words, you don't need to tell me to shut up.
Have you ever read the website for sertraline?
The website for sertraline?
Yeah. Sertraline, Zoloft, is a chemical that is marketed as a pharmaceutical, right?
Yes.
Right? It's a pill, right?
Yes.
And as we said, it's an SSRI pill, correct?
Yes,
Do you know that Zoloft is not indicated for generalized anxiety? Why'd you give her Zoloft?
it is a very effective medication for generalized anxiety disorder.
So you're familiar with the drug labeling for Zoloft, is that correct?
Generally,
Generally. Are you aware of what the manufacturer of Zoloft indicates it can be used for, to treat?
I'm aware that it's used to treat various forms of anxiety disorders as well as major depression.
So when Lindsay came to see you, you know that she had stopped breastfeeding her son, right?
Not at the time of the first appointment,
When did she stop breastfeeding? In October?
something around then.
You know that she had little or no psychiatric history other than seeing you, correct?
And the Prozac, yes.
You know that, in fact, that she had stopped drinking whatever it was that she was drinking, because you never asked, right?
I was not concerned about her level of drinking.
Well, it's in your form, right?
That was at the intake, but
Wait, did you know that she wasn't drinking when you were meeting with her, correct?
yeah, that's what she told me.
Okay, and you believe what she told you, right?
Yes,
So when she sees you, she's not on any psychiatric antitropics or whatever they're called medications, correct? She wasn't on any medication,
correct.
and she had stopped drinking anything, whatever it may have been, right?
I'm not sure when she completely stopped drinking, but yes.
You don't know when she started, when she stopped, what she drank, do you?
Well, I was not concerned that she was an alcoholic.
That's a yes or no. Did you have any?
But you know what? If someone is on these meds and you're drinking any alcohol, that is like a huge, huge um, issue. You can have all kinds of bizarre outcomes, and side effects are not in the disclosure of those. And these are some of these are black box meds, where it can turn into violence. So never take these drugs with alcohol.
Any idea? Because we spent a long time on Friday talking about her guilt and having that she drank alcohol. You don't know what she drank, when she started, when she stopped, do you?
I know some details about her alcohol use, but it was overall minimal.
What were the details then? Tell me what the details were. There was that one little box that was checked off. What other details were there?
That she drank 1 to 2 times a week, 1 to 2 servings 5 times a week.
And you don't know what it was? You have no idea, right?
I think she had mentioned at some point that it was calming. It was something that was
what? I'm
helpful.
sorry.
Calming.
Calming. Okay,
Calming.
so it was numbing. It was like trying to numb something, I guess, right?
That's one way of saying it.
I mean, I imagine you've treated veterans that have post-traumatic stress disorder, right?
Yes.
And would you agree with me that many times when people have an anxiety disorder or PTSD, or whatever the case may be, they try to numb their feelings? Is that fair?
Sometimes they do.
And sometimes they use alcohol, right?
Sometimes they do.
But we don't know what alcohol, so we don't even know if it was a beer, do we?
I didn't think that was relevant for her.
So with all of that, with that information, you then prescribed Zoloft to her, correct?
Yes.
You went over the side effects of Zoloft, Sertralina.
All right, there's a comment here. Madeira Beach caregiver, you're saying, speaking of the RX log, please note this. 2 vaccines in October of 22, new onset psychosis followed COVID-19 vaccinations. Lindsay's psychosis catalyst might be Moderna. Do we know if she was on Moderna or not? I was just looking it up right now, and it is rare, but mania and psychosis, it says here under a Genesis AI search, it says extremely rare instances of new onset psychosis or mania have been documented in individuals with no prior psychiatric history. And they're talking about those that have had psychiatric episodes that are acute shortly after the mRNA vaccination by Moderna. Although a direct causal link is difficult to definitively prove, but who knows? A lot of these meds have side effects that I don't think you were disclosed necessarily.
I imagine with
And like I've said, when I was asking about Dr. Yosef, they don't know how all these different drugs, if you're on multiple different kinds, what the synergy effect of all these drugs are. It's never been documented, and people can respond differently. So to me, it's very easy to get to some level of bizarre, crazed out thinking like this, given her postpartum and given the meds she was on.
her, right?
Yes.
Did you tell her that one of the known side effects is suicidal thoughts and actions and ideation?
Well, that's specifically in children. So I don't think I mentioned that because it wasn't relevant.
Not really. Suicidal ideation and homicidal ideation is a black box warning. Zola, along with other SSRIs,
Here he's talking about the black box warning.
right?
Under
Yes or
age
no?
for children and adults younger than Lindsay.
Doctor, I apologize. Can you just listen to my question and answer it yes or no? Is there a black box warning on Zoloft?
Yes.
And a black box warning is required or prescribed by what? The FDA?
Probably.
Probably. And it basically warns that, especially with young people or young adults, that it may cause suicidal or, God forbid, homicidal ideation. Yes?
Yes.
And you're aware that, in fact, the FDA has determined that that goes up possibly to a 23, 24, 25-year-old. You know that, right?
I think 24 is what they
Yeah,
say.
I'll give you 24. It's possible, is it not, that the SSRIs that get into a person's brain affect a person that's 3 or 4 years older than the FDA cutoff with suicidal ideation or homicidal ideation? It's possible?
There's a lot of development that happens in the brain between ages like up to 24 and closer to 30. The brain is fully matured at past age 24, and so it's less vulnerable than in a younger individual.
So with 24, you're suggesting as a cutoff, are you suggesting to the jury that a drug that increases the risk of suicide in a 24-year-old patient cannot increase the risk of suicide in a 29 or a 30-year-old patient? Just a little bit.
I don't believe there's evidence that it causes that at all in individuals over 24.
So, as a psychiatrist who had the ability to issue these types of medications to patients and citizens, what research did you do on Zoloft and suicidal ideation, homicidal ideation?
I was taught extensively about SSRIs and suicidal ideation in my training.
Right?
In Vermont, in Boston, yes.
Okay, so in Vermont was when you get your medical degree, right?
Yes,
And in Boston would be when you were a resident, right?
yes,
And then you had board certification on general psychiatry, right?
yes.
You can have a certification on the subspecialty, right?
There are certain subspecialties, yes.
Right, and some of the subspecialties deal with postpartum or women that are pregnant and have babies and have psychiatric symptomology.
There's no board certification for perinatal or reproductive psychiatry.
Well, there are plenty of classes that are recognized as, for example, at Harvard Medical School, there's an annual class or symposium, if you will, for postpartum. Have you ever been to that?
No, sir.
What have you done to research or to improve your education? I understand you went to med school and that you were a resident. What programs, continuing education, symposiums have you attended since you got the ability to prescribe these medicines to people?
I have not attended a symposium.
Have you attended anything?
I have not, but I have done a lot of reading on my own, of research and guidelines about this area in psychiatry.
Did you tell Lindsay when you were going, because one of the things that you guys are always concerned about is what's called informed consent, right?
Yes.
And what is informed consent? What does that mean?
It means
In a medical sense, not just like out in the street or something.
explaining to a patient the risks and benefits of treatment and possible alternatives, and making sure that the patient understands what you're saying.
Now, when you were going over the symptomology or when you were going over the side effects of Zoloft, one of the side effects of Zoloft is, and I quote, severe trouble sleeping, right?
Yes.
Did you tell her that?
Well, insomnia is listed as a side effect.
No. You already said yes, you know it. We just,
I've never heard a situation where a doctor is saying all the side effects, right? They usually don't say any. These psychiatrists don't. So, do you realize how long the side effects list is for these psych meds?
did you tell her that Zoloft has a side effect of giving the patient severe trouble sleeping? That's all.
So I didn't use the word severe because it typically doesn't cause severe trouble sleeping, but I thought you were referring to when she told me that she did have severe trouble sleeping,
Well,
and that
that's
was
what
true.
you told her, right? That she had severe trouble sleeping, right?
She told me, yes.
And you know that one of the side effects of Zoloft is, let's say, trouble sleeping. You know that, right?
Yes.
Your answer is yes. The jury has to be able to hear you.
Yes.
And why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
So individuals have very varied responses to medications. Some have no side effects, some have one or two. It's impossible to predict, but Zoloft is a top choice, a first.
Yeah, and you know what though? 1 out of 100 or 1 out of 10,000 or 1 out of a million, let's say, it can vary, can wind up killing themselves or somebody else by being on Zoloft. You cannot rule that out.
First-line medication for
Says
her.
who?
It was
Says who?
says it's the general consensus
Right, you know
among
about the lawsuits
psychiatrists.
against
Hold on,
Zoloft, right?
again, we can't have both of you talking at the same time. So let her finish her answer, and then I'll give you plenty of time to follow up any questions regarding her answer. So,
Okay, let me just show you something here on the black box warning for Zoloft. It says, and let me go ahead and stop the screen. We are at 59:10. Let me show this warning here. So here, this black box warning for Zoloft. If you notice here, increased risk of suicidal thoughts and behaviors in children, adolescents, and young adults aged 24 and younger during initial phase of treatment. The warning emphasizes that patients at any age starting the medication must be closely monitored for worsening depression or unusual behavior changes. So the highest relative risk is found in children, teens, and young adults under age 25. Studies not shows increased risk in adults age 25. So they're saying this, if there's not that it stops at 24, it's just that that's the highest. But like she just said, it can affect anybody differently. And so you don't know. You can't go back in time and know exactly what this was doing to her. And there's no test to determine how it was affecting her brain. There's no chemical imbalance test. And that's what was done in the 70s to market a lot of these drugs. And it's still being done a lot to this day, from what I understand. They say, oh, you have a chemical imbalance in your brain. So take the meds. And let's see. And it says here, look at this. So the highest risk is the first few weeks of starting Zoloft when changing the dosage. Okay. And then what are they doing? They're getting her off drugs of one kind and putting her on another. And then it says depression and certain other psychiatric disorders inherently carry a risk of suicide. Proper medical management is required to balance these risks. Okay. Was this proper medical management? That's what the jury here is going to take into account, and something that the civil jury will take into account as well. What to watch for: worsening mood or sudden changes of behavior. Okay. Or all of a sudden you feel like hurting the kids or yourself, perhaps. Appearance of new or severe suicidal thoughts. Extreme agitation, irritability, anxiety, or panic attacks. Severe insomnia or acting on dangerous impulses. Well, what if the dangerous impulses is to kill your 3 kids, right? So that's something I expect the defense to be raising later on. All right, let's go ahead here.
Finish your answer on that.
There's extensive research supporting the use of sertraline in this instance, and the general consensus among psychiatrists is that is a first-line safe medication for individuals.
How can you say it's safe when we just went over those side effects? Isn't that amazing that they can say it's safe? It can kill you. So you, as a psychiatrist, make the determination, hey, I'm going to give this to you. You take these pills. They may kill you, but general consensus is they're safe. Really? Do they ever tell you it may kill you? Come back to me right away if you start getting worse? I've never heard of that.
Including postpartum women.
How about the kids that shoot other kids in high schools and the lawsuits that come out of that against Zoloft? You ever read about them?
Overruled.
Sorry.
Good. I'm glad the doctor allowed this kind of questioning. That is something I've heard and seen as well, that all these school shootings, for those of you that are out of the country, we have seen so many of these kids, almost to nearly every single one of them has been on various mixtures of psych meds.
You didn't get it?
I wasn't sure what the question was.
The question was, in response to your observation about how all the psychiatrists think it's a very, very safe, wonderful first-line drug, and you researched it. How about the kids that kill other kids in schools with the lawsuits that arise out of the use of SSRIs? Have you ever researched that?
I don't know much about that.
Wow, why wouldn't you? Wouldn't you want to know that kind of information? You're giving medicines that's a black box warning, and it can kill the person, and they can cause extreme aggression. It's just unbelievable. This is what the state of psychiatry is in the United States.
You know about the SSRIs and messing with someone's brain. They go out, they shoot people for no reason, right?
I'm not aware that that's linked to SSRIs.
No, they don't want to get that out there.
So you didn't really talk to her about increased risk of suicide. The 24-year-olds are down because she's 4 or 5 years older than that. You didn't talk to her about...
It's not a cutoff. It's just that the risk is not as high. But based on the individuality of the person, they can have a drastic, huge effect on their mental state.
Trouble sleeping, that can be a side effect. But describe some, there's other drugs that you could have...
Okay, let's jump ahead. And so there, I think that ought to show some real troublesome things for the jury to see that this is not this does not seem like very, very high level medical care. Okay, so that was a 3.5 hour one on Monday. So basically, her conclusion was there was no basis for involuntary hospitalization. Tufts maintained that Clancy denied suicidal homicidal intent and showed no psychosis at the relevant appointments. Yeah, how can you really tell through a video? And you know what? If they really do plan on killing themselves, they're not going to tell you of the plan. Those that don't really want to kill themselves are more likely to divulge that. On Tuesday, there was Rebecca Gelada, a psychiatric nurse practitioner. Her exam was about an hour long. And Gelada was questioned about Clancy's treatment, including Seroquel, which is an antipsychotic, benzodiazepines and other meds, as well as reports of severe symptoms and intrusive thoughts. The defense used her testimony to argue that different providers were treating a seriously deteriorating patient without adequate coordination. I think I'll skip that one. There was some testimony from Wednesday on Letitia Dukes and also Trooper Dan Lawler and some medical examiners. Lindsay reported not wanting to be alive, but no safety plan was created. For the Middle State issue, this was probably Wednesday's most important testimony. Dukes is a social worker who saw Clancy testify that Clancy had expressed thoughts along the lines of not wanting to be here. But because she lacked a concrete suicide plan, she did not formulate a safety plan and did not consider her to be in crisis. Does that make any sense? Cross-examination also exposed that Dukes lacked information about some of Clancy's other treatment and symptoms. And the Dan Lawler, that trooper, there were some questions about the defense bringing up the idea that they're trying to discredit and refute the idea that Lindsay was told by a psychiatrist that she saw to say that you heard voices. So sort of a disjointed type conversation because it didn't relate to anything that was brought out on direct. But it does have to do with the fact that those command voices that Lindsay's supposedly heard, those are at the heart of her psychosis theory that the defense is going to be using here. And then we heard from Barbara Olson. She's a ME, medical examiner, who performed the autopsy of Cora. And the thing is, they're going over so many details on the autopsies and the gory details. And this is what I think that the jury is just let me straighten up the clip here.
Same finding and analysis.
So you raise your right hand to the clerk, please.
Good afternoon. Do you solemnly swear that the testimony of the evidence you shall
Oh, that's not.
Thank you. Thank you. You may have a seat.
Watch your step.
All right, good afternoon, doctor.
Good afternoon.
All right, I'm going to ask you also to keep your voice up so the jury can hear you and speak into that microphone if you would.
Okay.
All right. Ms. Sprague.
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
My name is Dr. Barbara Olson, BARBARAOLSON. I previously practiced under my maiden name, Barbara Vidal, VIDAL.
Can you describe for us your educational background, please?
I completed my undergraduate studies at the University of New Mexico. I also completed 4 years of medical school at the University of New Mexico School of Medicine. Afterwards, I came to Boston to study the field of pathology at Beth Israel Deaconess Medical Center. I completed a 4-year residency program there, studying both anatomical pathology and clinical pathology. And after my residency, I did a surgical pathology fellowship studying the gastrointestinal tract, liver, and pancreas pancreas, and I ended my training doing a fellowship of forensic pathology at the Boston office of the Chief Medical Examiner. I am board certified in anatomical pathology, clinical pathology, and forensic pathology.
And what is forensic pathology?
It is essentially the study of causes that are diseases, disorders, or trauma that results in sudden, unexpected, or non-natural deaths.
And do you currently work at the Office of the Chief Medical Examiner?
Yes, I'm a medical examiner at the Cape Cod office of the Chief Medical Examiner.
How long have you worked there?
Since 2021.
And approximately how many autopsies have you performed?
I have examined over 1,900 bodies and performed over 800 autopsies.
And when performing an autopsy, is there a specific process or procedure that you follow?
Yes. So an autopsy is composed of many parts. The first part being documentation review, and the second part being the examination of the body, which is broken up into two parts. The first part being the external examination, where I look for identifying characteristics of a decedent, such as eye color or hair color. I also look for any evidence of natural disease or trauma on the outside of the body. And the second part is the internal examination, where I create a Y-like incision on the chest and abdomen and examine the soft tissues, bones, and organs, looking for any evidence of natural disease and trauma. I also examine the brain.
And did you perform an autopsy on Cora Clancy on January 25th, 2023?
Yes.
And did you follow that same process with Cora Clancy?
Yes.
And so that started with a document review, is that correct?
Yes.
And what type of documents are you reviewing when you do that?
Typically, I have a preliminary police report to review, as well as either EMS records or records from the emergency department.
And did you start with an external examination of Cora?
Yes.
And what did you observe during that external examination?
The external examination of Cora, I saw evidence of medical intervention. She was intubated, had various EKG pads and defibrillator pads on her body. She also had a catheter on her right hand and puncture sites on her left hand and her left groin. She had her neck stabilized with a cervical collar, and she had an intraosseous catheter, which is a type of IV they put directly into the bone on her right lower leg. Her hands at the time of my
Now look at this. The defense attorney looks like he's holding her hand there. She's starting to shake. She's crying. This is where I think the prosecution is just not using proper discernment here. I think on how much detail they want to get into on the gore. And this is having an effect on her, not because she's a cold-blooded killer, but she was in some kind of psychosis or some kind of drug-induced, whacked out mental state.
external examination were covered by police evidence bags, and they were secured at the wrist with tape. When I removed those, the fingers showed no evidence of injury, and the fingernails were all of equal length and intact. And then I noted evidence of trauma of the neck with associated injuries of her head and minor injuries of her right arm and of her legs as well.
And in terms of the injuries that you observed, evidence of trauma to her neck, were there also injuries to her face and neck area that seemed to go along with the trauma to her neck?
Yes, there were findings with of the head that were associated with the trauma of the neck.
And what were those?
So on her neck, she had a ligature furrow. A ligature is an object used to apply external force to the neck or compress the neck. And a furrow is simply the pattern of injury that develops underneath the site of compression. So for Cora, her ligature furrow consisted of a linear, horizontally oriented area of pallor or paleness around her neck with distinct superior and inferior edges. On the front part of her neck, the lower half of.
So is the jury listening to this witness, or are they listening to the crying of Lindsay?
The ligature furrow was associated with additional red abrasions ranging from 1 to 2 millimeters in size. And on the back of her neck, the superior and inferior edges of the.
I guarantee you the jury's looking over there at her, and they're feeling sorry for her. And some of them are not going to be happy with this prosecutor bringing in this level of detail. when she's admitting responsibility.
Ligature furrow had developed some linear bruising as well.
And what do you mean by a furrow?
So again, the furrow is a ligature is when you have external compression by an object on the neck, and a furrow is simply a pattern of injury that occurs beneath it. It can be an imprint, it could be a pattern, or it could be more developed types of injuries such as bruising or abrasions.
And what about injuries?
All right, counsel could, we're
Oh my God.
going to take a break this time, all right?
All right. George, close your notebooks. Place them on the chairs, please. Just wait, please.
Look at these prosecutors now. You got her to cry. Is that what you wanted? You're trying to rub this in her face? Because she's just a cold-blooded, vicious, depraved heart murderer, right? No medication had any effect on her whatsoever, and you're going to prove that beyond reasonable doubt? Look at them. They won't even look over there. They don't have any concern whatsoever. This prosecutor here closely have O in her hair. They wear hair that she's doing just to try to gain a connection with the jury, because that's what Cora, the daughter, like to have, is bows in her hair. If that's true, that's really out of line.
We're going to be recessed for a few minutes. I'm going to come back. We'll speak to counsel in regards to schedule. Okay.
And you know what? She's not faking it. This is not like we had for Donna Adelson reacting to the verdict of guilty across the board, where the judge had to like send the jury back because Donna is throwing fits in the courtroom. You're going to tell me these are not sincere, agonizing cries of somebody who cannot stand to be alive because of what happened? I think they crossed the line here. I think these two prosecutors crossed the line. They just cannot let off the gas. They cannot show any ounce of a little bit of compassion for the jury, not having to listen through all this level of detail. And then you're going to have the defendant acting like this. So this, I think, is building a case of sympathy for the defense. So the prosecution is not getting the idea that what you're actually doing is helping the defense. I agree, truth seeker. That's not it's not fake sobbing, okay? If she wasn't paralyzed and she could kill herself, she would have by now. There's not going to be a good outcome for this either way, okay? So if she's found not guilty by reason of insanity, or if she's completely acquitted through involuntary intoxication, do you really think she's going to live long? I don't. So anyway, let me look at some of the comments here. Yeah, she's hyperventilating, can't breathe. Yeah, it is heartbreaking. Music, yes, I do think this is backfiring on them. So backfiring on them. They are this prosecution team. They come across prepared, in a way too prepared, though, or you could say lack of preparation with their witnesses, because they're leading them so much of the way, and defense is letting it happen. And I think part of it is got to be the more they talk, the less that their prosecution witnesses talk, the better it is for the defense, because the jury's not going to like these two prosecutors. Just a second here. Leslie sent me a message. Hold on a second, honey. Oh, yes, I also, well, if it's a mistrial, they don't have to retry it. They could just go ahead and adjudicate her as being incompetent. They don't have to try this again, just like they didn't have to retry Karen Reed a second time. Peanuts, you think they're cold-hearted? I think they're coming across cold-hearted. Rachel, you're saying some of the jurors will need therapy after this. It's ironic, yeah. So she killed her children, and how is that going to help her? If she was in a sane state of mind, how would killing her children benefit her in any way? Yeah, truth seeker. They can't read the room. I'm just shocked at this. So I think that's going to be a turning point. They're ready to poke their eyes out, listening to all these gore details day after day after day, and they're just piling it on. The prosecution is, and they're not even done. There's another Emmy that's coming in to talk about the eyes. Um. Okay. Looking for. I want to respond to a comment here. Hold on a second. I'm not seeing the comment. Leslie sent me a text message to respond to this one, and I'm not seeing it. I guess it's way back in there, but I do want to find it. Anyway, we were just talking about one of these one of the folks that view this channel. If you do any of you recall, when was it, about 2 months ago, I said that LJ, our one of our cats, was had an open rash on her neck, and we could not get her to stop scratching it open. It was bad. I couldn't, steroids and nothing we gave her from the vet was working. And someone named Nancy Blanchy, you asked tonight, you hope your kitty's skin is better with the churro treats. My kitty with itchy skin is still doing great on the skin and coat formula. So, yes, actually, we've turned a corner, and LJ is doing wonderful now. It's actually healing up. It's not totally healed now, but she's not scratching anymore, and it's not bloody anymore. So, yeah, those chewy skin treats. It's like a tube that you feed them, just like a delectable tube. I don't know if any of you with cats know what that is, but it actually worked. It's very similar to delectable, the ingredients. But thank you very much for telling us that, because I don't know what would happen to LJ if we wouldn't have tried that. Surely the vet didn't tell us that. All right, so let me go ahead.
Yeah.
All right, then she goes on to testify after this break.
There's a remote here. If you press and hold the top button, you can highlight what your
Additional bruises on her left lower leg.
and then 7775, please.
Look she's still traumatized by this whole thing. This is not a cold-blooded killer, okay? This is somebody that was messed up on hormones and psych meds. Wendy, you're saying I couldn't have been on the jury. I would have been unable to control yourself. But you know what? Yeah. I think a lot of people just don't get it. She's a cold-blooded killer. She hated her kids. Really, there's no motive to gain here. Should instantly be arrested. Just wanting to take your life when you have 3 wonderful kids is because you have some depression. If it's a little bit of depression, no, it's severe mental deterioration. Okay, thanks, Teresa. Reddington at one point says she continues to not want to live. I see that. Okay, so let's go ahead. So this doctor and medical examiner describes the physical findings and mechanism of death. The testimony established the mechanics of the death, although the defense elected not to meaningfully contest that portion of the case. Then on Thursday, we heard from Sergeant Timothy Ciappini and about digital evidence and some of Lindsay's digital searches. And some of her searches included things like hallucinations, mental health, and 4 days before the death, she wrote, "Can you treat a sociopath?" in her search bar. So I think it tends to support that she knew in her that something's deeply wrong with her thinking. Hold on a second here. I'm going to show this other clip.
Now, this area here, this separate report, is this the notes that were found on Ms. Clancy's phone?
That's correct.
And if we could zoom in on that, please. And there's basically detailed in journal form, correct?
Yes.
Starting October 24th, 2022, and moving down, correct?
The summary portion that you just pointed to is automatically generated by the application when it reads the first few lines of text.
Yeah, for affirmation, she loves her kids. She's a great mom. All that kind of stuff. Yeah, that's what she was like before this downhill spiral.
The more relevant date is in the column to the left.
So over here, where it says created, October 25th, 2022, that's when the note is first created?
That is the date that's detected by the analysis tool from the operating system of the device.
What does modified mean?
That's the date that was detected by the forensic tool and the last time that this note was modified according to the operating system.
Modified mean it was changed in some way?
Yes.
And so if I start a note in my phone on October 25th and I go in there every day and change it, and the last time I change it is November 3rd, will it show every modification or just the last modification?
The only date timestamp that will show is the last one.
Let's go see some of those things up on the screen. Hold on. They have a lot of breaks in this trial. Unusually high number. Stand by.
Where the cursor is now, it indicates the modification date.
So above it is when it was created, below it's when it's modified? Or no, down here, capture time and the metadata is when it was initially created, correct?
Correct. And you look at the source file, you can see the source file indicates that the image was modified under the component where it says adjustments.
So just for the jurors looking at this report here in the metadata.
Here, I'm going to go 149.
System of the device.
What does modified mean?
That's the
Searches at the same time, like it is displayed there.
The Celebrite Physical Analyzer tool parses the information in ways that the information can be categorized in a multitude of ways. Simply because there is more than one entry does not mean that something was done more than once. It's simply just a category that Celebrite has identified. You could have an item that's in searched items because that's what the tool has identified as a searched item. Also within web history, as in the search item occurred within the web history, does not necessarily mean that it was done more than once. It's the job of the examiner to be able to look at the timestamps and the associated databases to determine, is this more than one entry or the same action just categorized in multiple ways?
And when reviewing Ms. Clancy's phone, did you see numerous occasions where it looked like something was searched multiple times, but it all had the same exact timestamp?
That's correct.
And so what you just testified to make sure I'm understanding it, would it be accurate to state that one search could be documented and located in many different areas of the phone?
It could be parsed in multiple ways by the analysis tool.
So basically categorized?
Correct.
So it's one search that's categorized as multiple different things. The 12323, that's the date that the picture was changed in some way?
Yes.
And are you able to tell how the photograph was changed?
I can do analysis based on an image and see that an image from its native format was modified.
So basically, if I'm on my phone and looking at photos and I brighten something or I crop something, crop someone out of a photo, that would show it as being modified?
It would show it as being modified. In this instance, it created a new file, which is why it has the created and modified date being the same.
And so would it be accurate to state that on
All right, this is boring here. Let me jump ahead. I'm trying to get
14 seconds at 5:34 p.m., correct?
Yes,
That means the call lasted approximately 14 seconds.
correct.
all right. We know all about this. Okay, unbelievable amount of detail they're trying to show here.
He had appointments anywhere, it would have been presumably, if she put it in the phone, in her calendar, right?
Yes.
Okay. So when you looked at your investigation, directing your attention to the start time, what date are we talking about here?
The start time is August 14th, 2022, midnight. End time would be August 14th, 2022, 11:59 p.m.
Okay. So if you look down to the next one, it says, what date?
August 23rd, 2022, 10 a.m.
Okay. And did she make an entry
She
on
did.
her computer on that date and time?
She did, sir.
And can you tell me what the entry was?
Subject is 10 a.m., Callan, Kingston, vaccine.
So Callan would be the son. She had it in her phone that he had an appointment to get a vaccine at 10 p.m.?
The time is 10 a.m.
10 a.m., okay. And the next one, what is the next one?
Would you like to know the subject, sir, or the date?
Yeah, sure. Just whatever the date is and then what the subject is.
Okay. The start time is August 23rd, 2022, 5 p.m. The subject of the entry is 9:45, Kingston, Dawson, ear check.
And that would be indicative of an appointment that she had at the pediatrician's office for Dawson's ear check at 9:45 in the morning. Is that correct?
Could be an inference, I'm not sure, but that's the entry.
Okay. Now, looking at Exhibit 235, you can tell me, what is this document?
I recognize it as a screen capture from an Axiom phone extraction.
All right. And you did indicate you were Axiom qualified, right?
I am not, sir. I'm familiar with the program as a result of my training with Great Key. Magna Forensics owns Great Key Technology, and in the training course for Great Key, process extraction using Axiom, but I'm not certified in the software of Axiom.
But you can interpret it. You understand what that shows you. It's just a listing of different activities on the phone, right?
I'm aware of what the screenshot depicts, yes.
All right. Can you tell me see the highlighted one? Can you tell us what that is, the date and the time and what it's referencing? Do you need a magnifying glass?
References a website, sir.
And what's the website?
Mail.google.com.
That mail, like MAIL, right?
Yes, sir.
Okay. Does it indicate whose mail it is? Does it show it on the right-hand side of the box?
I can't definitively determine whose mailbox it is.
Okay.
Trooper, I'm going to ask you, make sure you keep your voice up, okay?
Yes, Your Honor.
All right. So more breaks.
And also a search for Wellbutrin.
Yes, sir. Wellbutrin is a keyword as part of a Google search.
Does it say what the time frame is?
It does.
What is it?
January 16th, 2023, 9:14.
Another psych med. She's still searching, trying to find something that's going to help her get out of this death spiral she's in.
47 seconds a.m.
Okay. And a search for McLean.
Correct, sir. McLean is part of a keyword of a Google search.
What's the time frame?
December 29th, 2022.
All right. So I'm going to stop it there. And so my conclusions from looking at last week is that, yeah, she was on dangerous mind altering drugs. You don't go from having a normal life to all of a sudden just everything spiraling out of control. And then even people that know you think everything's normal, then all of a sudden you go off and do this horrific act and then say you're sane. I don't see that happening at all. I just don't see the jury dismissing outright completely and saying she's guilty and none of this stuff had an effect. It's either going to be a hung jury or it's going to be not guilty by reason of insanity. Those are most likely outcomes. If they do the not guilty by reason involuntary intoxication, then that one's a complete acquittal. She can not walk out, but leave the courtroom a free person. So I'm not sure they're going to do that, but I think that the more the prosecution is doing this jugular approach, going for the eye gouge, I think the higher chance she has of actually having an NGI. Yeah, some of you guys are saying Patrick had a hand in this. I'm just going to say that could he have done things differently? Yes, but was he totally overwhelmed? Did he know how to deal with this? He didn't want to understand and accept the fact that she was possibly bipolar. So, yeah, Susan, you're right. She loved her kids and tried to get help. Okay, and the help wasn't working right. No matter who you want to point the finger at, this stuff wasn't working that she was trying to take. She wasn't in the right hands to be able to fix her. If she was maybe with a Dr. Yosef, we're talking about, this case would never have happened. I sincerely believe that. You don't start just throwing pills every which way to try to help somebody. Oh, here, try this pill. Oh, that one doesn't work after a couple weeks. Well, try this one. Keep moving it around. There's been no test on what these drugs do to you when you combine them like that. And each of us, as this doctor did admit, each of us do respond differently to these drugs. So we'll see how much longer the prosecution is going to go this week on going into these gory details, but it is helping the defense. I think the way they're just dragging this thing out. So with that, I'm going to go ahead and sign off. You guys have a great night. I hope you get on here during the week and cover more of this case and also cover more of what's going on down in Jacksonville. The Jared Bridegan murder case is starting tomorrow. And they're going to have multiple trials going on in sequential order. So I hope to discuss those as well. So with that, you guys have a great week. Thanks for looking at this case. This is more about mental health in so many ways than it is about legal matters, but these two are intersecting now for this case. So stay tuned and we'll be back. Take care. Good night.